The attention of the world is polarized by the coronavirus pandemic. We understood in the last months how crucial was the role of social media. Social media are not just useful for the awareness or for stroke campaigns. Um, Social media are important to filter fake news. We call it infovigilance. They are crucial to understand the level of illiteracy in the population. So, how high profile science um, is understood by the community. The European Stroke Organization Social Media Committee decided to organize talks. So, what's about to begin is a short travel around the world that will start in Europe. From Brno in the Czech Republic, Hanna Mashalkova will present the Hobbit project, a brilliant idea on how to spread stroke knowledge in the community.
Hello, my name is Hanna Marshalkova, and I'm stroke awareness specialist in St. Anthony University Hospital, Brno. Today, I will introduce you 5 tips how to promote stroke information via social media. I will not give general pieces of advice, but I will rather focus on particular examples of what we have implemented. The social media which we use are connected to educational program Hobbit that teaches children. Facebook, we have Instagram, YouTube channel, and a part of socials, the website, of course. To spread the information about stroke among as many people as possible, it's important to offer users quality content that they will want to share. 5 interesting and effective ways how to do it are sharing infographics, videos, stories, contests, and online events. First of all, infographics allow you to share data and boring facts in an entertaining and clear way. In that way, we, for example, posted facts about brain, how to avoid stroke. And what worked really well was to connect our topic with coronavirus as well. So we shared comparison of how many people die from stroke versus coronavirus, and also suggestions how to prevent coronavirus. Those posts were enormously shared, so it's really great to react to current situation and not to be strictly focused just to one topic all the time. Even more successful than infographics are GIFs and videos. People love receiving facts in an entertaining way. In May, we created a video showing if it's better to call an ambulance or to take a stroke patient to the hospital by your car. The reach of this video was 6,500 people, and it was shared 33 times. So this was one of our most successful posts in several months. People also like to read and share stories about stroke survivors. So you can share whatever you will Google up, but more powerful is to cooperate with someone closely. For example, our team has been cooperating for 6 years with our stroke ex-patient, Carolina, who was affected by stroke when she was 21. And as she is willing to share her story with media, we have plenty of content to share back on our socials. So cooperate with patients and their families and share their stories because it's one of the most powerful things. It's also good to involve your fans actively. For example, to hold contests. And what we've started in 2015 is the Act Fast Challenge. We have created a symbol for stroke, which is on yellow balloons and pink buttons, and people take pictures of it all over the world. On our website, you can find a map with all the pictures, and you will see that we've already conquered 4 continents. The challenge is very easy, fun, and thanks to it, we spread the information about stroke to younger generation. Lastly, I have a tip regarding holding stroke events. Of course, due to coronavirus, we had to cancel all our lectures and preventive events, but we have developed a concept for World Stroke Day. Via Facebook, we will broadcast a series of videos about stroke, lifestyle and prevention, and also some interviews with physicians and ex-patients. Videos will be available on YouTube, and I'll be happy to share later with you how successful this event was. So those were 5 easy and fun facts, fun ways how to share information about stroke with lay public via socials. And if you have any questions, don't hesitate to contact me via phone or email, and also go to our website, projekthobbit.cz. Thank you.
The second talk is coming from Rosario, Argentina. Dr. Isabel Fumagalli will talk about Argentine projects in social media and infodemiology, a technique that help us to understand the interest of the web public on specific topics. But before her talk, we will watch a small video. It's a 1-minute video on a specific initiative that was undertaken by an Argentine foundation, bringing football and stroke awareness all together using TV communication and social media.
El superclásico en la final de la Copa Libertadores desató la locura de un país. Pasión, tensión, Miami, Qatar, Madrid, ¿accidente cerebrovascular? Sí, los medios hablaban de cómo prevenir un ACV durante el partido.
Para tratar acá el partido Boca River.
Puede ser un ACV hasta que se demuestre lo contrario.
En Fleni somos expertos en prevención, diagnóstico, tratamiento y rehabilitación del ACV. Teníamos que sumarnos a la conversación. Si fuimos a un panel en la TV, no, nos subimos a otra polémica y creamos ACVAR. Desarrollamos un bot en Twitter que traqueaba las menciones de VAR en tiempo real y respondía con un video que analizaba los factores de riesgo del ACV en cámara lenta y desde distintos ángulos. Si reclamabas VAR, te impactábamos con ACVAR.
Hello. My name is Isabel Fumagalli from Rosario, Argentina. I am neurologist. I would like to share with you some great stroke campaigns, awareness of stroke in Argentina. I would like to say thank you to Francesco, and for me, it's an honor to be part of ESO social media committee. I'm so glad to share with you about stroke and the word in Spanish. The key word in Spanish is accidente cerebrovascular. I would like to share some awareness stroke campaigns for World Day of Stroke, and also I would like to share some research about the word ACV through Wikipedia, through the page views like Toolforge, and also through Google Trends. Next. Stroke the Instagram. It was a great challenge. Fleni, a foundation for neurological illness in Argentina, has been selected to receive a World Stroke Campaign Award for Best Campaign in a High-Income Country last year. The campaign was excellent. They tried to show through Instagram's account all risk factors of stroke to public, and a lot of followers can participate. Next, they reach 1,200,000 people who reach the campaign and also participate with trivia games. And the terms was about treatment of stroke, about stroke risk factors. They decided to focus on the young population, where the impact of prevention campaigns can be greater in the long term. Next. Using the stories feature of Instagram, they invited the public to participate in different trivias with sample questions about stroke, about recognition of symptoms, and a good stroke treatment. They also provide information about recent epidemiological data of stroke in Argentina and brief paragraph with information on risk factors. To increase participation, they raffled 2 tickets to our Solidarity Gala at Colón Theater in Buenos Aires. Colón Theater is one of the most important opera houses in the world. Next. They design influencers, but influencers like with attractive video for difference and other influencers whose profiles are related to health to share on the occasion of World Stroke Day. The message was amplified by influencers in a total up to more than 1,200,000 people and followers. A lot of number of people participate in both trivia games. The campaign was seen more than 15,000 times. Influencers shared our Stroke Day aware message, and all was very beautiful. We believe that our campaign contributes from a novel and innovative perspective, reaching a large number of persons in a short period of time. Another campaign was in my city, in Rosario, about 3 Spanish words: habla, brazos, and sonrisa. Sonrisa is a smile, brazos are upper limbs, and habla is about languages. The campaign was also great, and the campaign was focused on outdoor recreational walkings and activities. And a lot of patients participate, and it was so beautiful. I did some Google Trends searches about accidente cerebrovascular in Argentina. I found the word is a very replicated. Also in Wikipedia, about last month, and about Tool4G search, the next, I found 400,000 visits during 1 year period. It's very interesting, this data. The next, another data in different graphics. And there are a wonderful and very complete stroke page integrated by patients and doctors. The name is Por una vida libre de ACV. It's like life free of stroke. And they are adding followers and they are work a lot. I think social media has a lot of tools in order to provide information and educate people and educate community in order to awareness of factor risks of stroke, symptoms, and it's very important the intelligent use of these tools in order to reduce the burden of stroke. The future is a challenge and we have to improve and to educate in stroke awareness. I would like to thank you and I would like to work together in order to improve healthcare, and in COVID times also it's necessary the future of stroke and the use of social media in order to help more people than we think. It's
The last talk today is coming from Maryland, US, where Dr. Habtom Tesfaghebriel will present a small talk on social media in a large and dynamic African country, Ethiopia, where the availability of computers and ground lines is smaller and the large amount of population is using the web, internet via smartphone and mobile phones.
Hello, everybody. My name is Dr. Habtom Tesfaghebriel, medical training in Italy. I currently live in the United States. This video is the evaluation of the use of the internet for the research of medical information in Ethiopia. In particular, our interest is to evaluate the use of the internet to get information about stroke in Ethiopia. Ethiopia is the second most populous country in Africa with a population of more than 100 million. Only about 4.2% of the population has access to the internet, mainly using the smartphone. In Ethiopia, there are so many languages. The main three are Amharic, Oromo, and Tigrinya. We have tried to find a page about stroke in the Wikipedia in one of the local languages of Ethiopia, but we could not find any. And even the term stroke in Ethiopia, there is not an equivalent term for stroke in any of the local languages of Ethiopia. Therefore, physicians and common people use the term stroke. All right. Now we have tried to compare the Google research for stroke with respect to the search for diabetes and the search for famous people in Ethiopia. Here in this graph, the red graph shows the search for stroke. The yellow graph shows the search for diabetes. The violet graph shows the search for the Prime Minister of Ethiopia, the current Prime Minister of Ethiopia. The blue graph shows the search for a famous singer named Teddy Afro. And the green curve shows the search for another famous singer named Hachalu Hundessa. From this graph, we see that the research for the term stroke in Ethiopia has been very low throughout the time we evaluated. While the search for diabetes is still low, but there has been a peak around July of 2020. I could not find any explanation for this increase of interest for diabetes in Ethiopia. It's possible that a famous person may have been known to be diagnosed with diabetes, but I'm not sure about the reason why there has been this increase in the search for diabetes. The violet graph, which shows the search for the current Prime Minister of Ethiopia, shows a peak around November and December 2019, which coincides with the Nobel Prize, the Nobel Prize for Peace, the Peace Nobel Prize that the Prime Minister has achieved in 2019. While if you see the blue graph, there is a peak around August of 2020. This peak coincides with the release of the new song by Teddy Afro, by this famous singer. While following the green curve, we see a big peak around July 2020. This coincides with the days of Hachalu Hundessa. From this graph, we can see that the use of the internet or social media for health information in Ethiopia is very low. Usually the social media and the internet is used for entertainment, and for the news and politics. Thus, our evaluation is that if there is a campaign to raise awareness about stroke or other medical issues in Ethiopia, a good method would be to use television or radio, like using announcements through radio or television, or short plays using television and radio. Thank you so much.